So now we expand the use of this visceral challenge technique in QA steps 5 and 6. If we have a weak muscle present, that makes things a little easier, because we can see if it strengthens on autonomic challenges with vision, with the eyes, and with TMJ retrusion and protrusion, which we're going to review again in a minute. But if we have a strong muscle, we have to use this PMPS type testing. And we screen for visceral dysfunction by using the TMJ as a diagnostic indicator to figure out which organ is involved next to treat. When we use the TMJ as a diagnostic indicator in the procedure we're presenting this weekend, we are able to identify the hierarchy of which organ is necessary to treat first, next, and last. That's the critical thing, is what we've learned is that some organ dysfunctions will not show up until you fix another organ dysfunction. Let's say you had a pancreas problem on the left and a liver problem on the right. And the liver problem was affecting the body, coming up and affecting the right cerebellum and across to the left midbrain. And the pancreas was affecting the body because of the Chapman's reflexes throwing off the rib movement, affecting the left cerebellum across to the right brain. Let's just say kind of a stupid thing and say the liver problem was worse than the pancreas problem. If the liver problem was worse than the pancreas problem, it would be affecting the cerebellum on this side and the mesencephalon and midbrain on this side, and that effect would be such that this would show up first, and you wouldn't find the pancreas problem until after you fix the liver problem. After you fix the liver problem, which is affecting this part of the mesencephalon and midbrain, then the pancreas problem would show up because it was being hidden by this factor affecting the right cerebellum and the left mesencephalon. This was dominating the body's nervous system patterns, and all of a sudden when you fix that, it blows that smoke screen out of the way, and all of a sudden the pancreas problem shows up because it's affecting the other side. It's like one layer on top of the other, and since one affects one side and the other one affects the other, oftentimes fixing them in the right order becomes very important. And oftentimes fixing them in the right order is such that if you don't fix them in that order, you won't find some of them. So that's what this protocol TMJ motion is all about, and the different movements of the TMJ.